we are back, and we have Connie and Jamie with us this morning. Good morning.
Good morning.
Good morning.
Thank you for having us.
Connie is with Nash UNC, and Jamie is with Nash County Public Health, Nash County Health Department. And thank goodness for both of you right now, let me tell you. And what do both of you do? You work together as partners, kind of,
Yes, we are
on
community
infectious
partners.
disease?
That's right.
An infection preventionist nurse
Okay.
in the hospital.
And I'm local public health communicable disease at the health department.
Okay, a mouthful.
Yes.
So, but we brought you on to the hospital. Actually, called us and asked, did we want y'all to come on and talk about the coronavirus? And I said, absolutely, because we're hearing, what's going on in other areas and nationally, and we still want to hear that and what we should do. But we want to know about our community as well. So, anyway,
and what people should be doing.
Okay.
Absolutely.
Yes.
and you have a PowerPoint this morning.
Yes.
That we can show, I believe, if Pete is ready. We can get started with that, Connie.
And,
If you want to start
and
with
before when we were on the air, you were explaining the breakdown of COVID-19. Before you start, will you do that?
Yes. What does it mean?
If he can show the next slide for our viewers. COVID-19 is a novel virus. That means it's new. We have not identified it until December of 2019. It was discovered in Wuhan, China. Coronavirus has been around since the 1960s or before. It was just discovered and named in the 1960s. The common cold is a coronavirus. And many of your viewers have probably heard in the past about SARS and MERS. Those are all coronaviruses.
Oh, really?
Yes, and so I think
right.
about, these have evolved and there are different strains of it. So this newest strain is what we're dealing with or hearing about in the community and on the news. It is a virus that's spread by coughing and sneezing, and that's why it's so important. Like the flu is a virus, but it is not the coronavirus. It is an influenza type virus, and all of these viruses you need to take into account. Don't touch your face. Be careful about touching your eyes. Wash your hands frequently, and we're going to show you some slides about that. And definitely watch your personal contact with one another. We say right now, even with the flu, you shouldn't be shaking hands.
Right.
With the coronavirus, don't shake
right.
hands. Maybe do the elbow bump
Yes,
or the
I don't
fist
mind
bump.
telling
I don't even like
somebody,
doing the
I'm
fist
sorry.
bump because I don't want to touch your hand.
Right.
Yeah. I'm fine with not
Not touching
let's
at
just
all.
not do this right
Yeah,
now.
exactly. And that's what we say, go into our churches and things. I'm not shaking hands right now.
No offense, please.
Exactly. So there's ways that we can do that. And Jamie, you might have some comments also about
Yes,
how it's spread.
we urge you to disinfect surfaces frequently at home, at school, at your work, your keyboards, your cell phones, your telephone. You want to disinfect that surface frequently because it's spread by droplets. So when you cough or sneeze, you want to cover here,
I want
not
Pete.
here.
I was gonna say I want Pete to come back and you show that again because he had the slide up.
Oh,
too.
okay. I'm sorry.
That's all right.
So, yes, we want you to disinfect surfaces frequently. One that gets coronaviruses, you can read the label. And when you cough or sneeze, we want you to cover in your elbow, never your hand. Or use your shirt like this, or a tissue, and immediately use hand sanitizer, getting all your surfaces, or we'll go and wash your hands for 20 seconds with soap and water.
I was going to say, are you not of the belief that soap and water is the ultimate?
Oh, absolutely. For 20
But if you
seconds.
have to use sanitizer and you're somewhere where they don't have soap and water, it's okay to use sanitizer.
Absolutely. Use both of them. But soap and water removes debris, and then the friction and the running water and the time removes viruses, bacteria from your hands.
They say do the happy birthday song.
That's
That's
right.
right. I heard somebody say do the Lord's Prayer.
That's right.
That's awesome.
Yeah. Probably need to pray right now.
Yeah. If you have to scratch your nose, how about using your arm instead of your hand?
Yeah, I mean, that
How do
bend
you
of
do
the
that?
elbow.
Like this?
Yeah, or your forearm, and certainly, again, you're avoiding your hands. And that's coming up with some techniques that work.
That's
for you.
right.
Okay, we'll go back to our slides. Here we go.
Yeah, this is one we wanted to show our viewers about how it's impacting us globally and the countries that are impacted. And I really want to call everyone's attention to the U.S. stats that 38 states have been involved or have had the coronaviruses confirmed in their state. There have been 938 confirmed cases, but notice that there have been 29 deaths. One death's one too many, but of those deaths, the average age is 80 years old. So this is really, again, where you'll see on our other slides that we're emphasizing that our senior citizens really take the precautions, because this tends to be very an illness, more detrimental illness for those 60 and older.
That's right. Or someone with a chronic health condition that affects their lungs already, whether they're young or old, or someone immunocompromised already.
Right.
So heart disease is another comorbidity, and diabetes as well. So we'll talk about more cautions that you can take. But then when we look at North Carolina, we have had 7 confirmed cases in just 2 of our 100 counties right now. And so we are preparing, and we want to inform our citizens. We've not had any cases in Nash County, but again, we're going to talk about strategies that we all can do to be safe.
If we look at these numbers, we need to keep in mind that the flu cases and death rate is much worse than this.
Yeah,
and we have a vaccine to prevent flu. We have antivirals to help if you get the flu. We don't have anything for this, and yet our flu rate is much higher.
It's still much higher. What is the real difference between, Lisa had that question earlier,
between these
between
two
the
viruses?
the flu and coronavirus.
They're both viruses. Viruses mutate. They change each year. That is a similarity, but the difference is coronavirus, this particular one, we have no protection against that right now. Our protection is washing our hands, limiting our travel, not making contact with a confirmed case, not traveling to a country that is high risk, where this all originated.
Large
like
gatherings.
Large gatherings, just avoid those right now.
How about
Social
church?
distancing.
Church for older people. What do you think about that? My mom's church, the first thing they do when they get in there is they hug everybody. I said, Mama, stop hugging people.
Well, the risk is that if you have traveled and if you have been in contact with a confirmed case, and right now we've limited those, we found them because the U.S. is using a containment strategy. So we identify the cases, we assess the cases, contain them, and isolate. So by doing that and limiting travel, you're not seeing just anyone that's been confirmed as a coronavirus case.
Right, right.
And I want to say, like for churches and schools and
Hey, you
communities,
can come back to us.
you can go to the CDC website, and there is, and do CDC coronavirus, and there are links to specifically about communities,
Right.
what you can do in your church setting and in your school setting. Same thing I like the North Carolina website too. So if you do NCDHHS
Right.
DHHS.
coronavirus, that will take you to some good resources about the most frequently asked questions about the virus. It goes over hand hygiene.
That's right.
It links you to the CDC.
And it's important to get accurate information.
Yes.
Yeah.
CDC and our state site have the science. They're putting out the accurate information.
Okay.
So trust those sources before all the news medias.
Yes,
And
yes.
different.
You talk about wiping everything down. What if you can't get Lysol? What if you can't get Clorox?
Well, Clorox bleach is in pretty abundant supply. So you can make your own cleaner every day. You can mix 4 teaspoons of bleach in a quart of water, put it in a spray bottle, and surfaces that wouldn't be harmed by bleach, like maybe this phone here, non-porous surfaces can be wiped down with that disinfectant, and it's very effective. But it has to be mixed every 24 hours.
Okay. So 4 teaspoons of Clorox to 1 quart warm water.
Interesting.
cold water? Does
Well,
it
it's-
matter?
After 24 hours, it's eventually going
yeah,
to be
you're
room
right.
temperature,
Yeah,
but it's
yeah.
fine
Uh-huh.
either way.
Uh-huh.
Okay, let's go to our next slide.
So these are the symptoms: fever, cough, difficulty breathing. People have reported shortness of breath. And then those who are high risk, those are 16 over, have had severe illness. And again, the children and the young adults are more prone to get flu than they are this coronavirus. So the healthy adults who have had the coronavirus, it tends to be a mild
Right.
infection. Next slide. Okay, and this was one thing we
yes.
want you to, be aware of. Call your medical provider if you have questions. The cold has body aches. You may get fever, cough. You feel achy, and that is the cold is a gradual onset, where the flu is a sudden onset, and the coronavirus may mimic like the cold symptoms. But again, you have to have those high-risk exposures to somebody known to have it, or you've traveled. And so if you think you're coming down with respiratory symptoms, call your medical provider. And here's the coronavirus hotline for the state, but call your local provider. And most of our providers we're in touch with are putting instructions on their voicemail. So when you call, it'll give you directions even if it's after hours.
That's right. We want you to call before you go to your provider. Call before you go to your nearest urgent care. And if you must go to the ER, we want you to alert EMS, alert the ED by a phone call. Family member can call for you and say, I have traveled and now I have symptoms and I need to be seen.
Okay.
So they can put on the appropriate PPE, which is protective gear, to keep this virus from spreading to our healthcare providers.
Right, sure. Now, how long does it last? I'm hearing that it only lasts a minute on surfaces. It's very
Oh,
short-lived
no.
on surface.
Oh, no,
That's
no.
what they're saying.
No, it can last a very long time on surfaces, hours, and it depends on the surface. I was hearing that this morning. On certain surfaces, it's longer than others, but it can stay for several hours
Right.
on a non-porous
See, that's one of those
surface.
misnomers
Yeah,
that's out there.
And it can stay in the air for several hours because it's droplet spread.
You think about, we were talking about money, about people were saying it was on money.
Yes,
but
that's a
think
good
about your
point.
debit card.
That's
How many
right.
times do you
Oh.
hand your debit? Forget
Yeah.
cash.
I
How many
clean my
times do
debit
you
card.
hand your debit
Yes,
card
yes.
to people? I mean,
right.
it's
So things like that you can disinfect. Cash you can't.
That's
and then
right.
One of the resources on CDC and our state website talks about that. Be thinking about the things you touch every day, and like grocery cart handles,
Right.
and door handles and knobs,
Well,
and your cell phone, as Jamie had brought
Yes,
up.
the grocery stores have those wipes as you go
They
in.
do.
Take one and wipe the handle of your cart off.
Always do
I'll
that
wipe your
anyway.
hands. I keep hand sanitizer in the little pocket of my door of my
Me
car,
too.
and I use it. I hand my debit card, I use it, and then when I get my debit card back and put it in my wallet, I use my hand sanitizer.
Very good, very good.
Governor Roy Cooper called for North Carolina to be under a state of emergency. And this is not a scary thing. It's a tool in our preparedness plan that allows the governor to enact the emergency system for our preparedness plan,
Right.
to come into agreement with groups that can aid, like Red Cross. And also it allows him to have executive power to enact other laws that would protect the public
Right.
as needed. It just opens the door for releasing funding
Yes.
to help
yes.
fight this.
For supplies
this
and for various
pandemic.
things. It's
That's right.
But you know, when people hear state of emergency, we normally hear
It
that with
scares
you to death.
hurricanes
Oh
or
my
you
gosh,
know,
oh my
this
gosh.
is
But
yeah.
it's not
This-
what you think.
This is for anything that's an imminent danger, and a pandemic is imminent danger to the public, but we have plans in place to mitigate this danger, and everybody has a part. And the baseline part for everyone is to wash your hands, cover your cough and sneeze, not in your hands. Disinfect surfaces. Limit your mass gatherings. Maybe stay home if you're sick. Absolutely stay home if you're sick. Employers, have some leniency in your policies to allow employees that can work from home, and employees that are sick, allow them to work, to be home while
Absolutely,
they're sick.
I do. My staff will tell you if they have a cough, I say don't come today. I mean,
Yeah.
even a cold, don't come in here.
Yeah, I do not want to be around
Because
anybody
you're gonna-
sick. Yeah, Pete, you're about to go home.
One person,
He's in there hacking.
Coughing behind the scenes.
yeah, one person is sick, and then they come, and then I've got 4 out.
Yes,
so,
that's
you
true.
know,
That's right.
anyway.
But we need
That's
to
right.
remember the risk for this coronavirus is if you have traveled to a high-risk country or you have been in contact with a confirmed case. Otherwise, your cough and sneeze and sore throat and congestion might be the flu or a bad case of seasonal allergies.
right.
So really, people need to go about their day-to-day life just like they have been doing it for years and years. Just be more conscious about
Diligent
washing their
and
hands.
That's right.
Yes.
Hand
Right.
washing
Yes.
is so key.
It's so key. And doing it properly. And using hand sanitizer in your car, in your shopping, where maybe you didn't before.
Right, right.
Just take some in your pocket.
Or wear your
Absolutely.
gloves.
All right, we'll go back. Okay, here we are.
So this is hospital preparedness, and we'll tell you our hospital has a plan, as all of the North Carolina hospitals do, and our public health departments and our emergency services in our communities have a plan. And we are talking daily and weekly, and we're tweaking our plans and adjusting them as we get information from reliable sources such as our state leaders and the CDC. And one of the things that has been prepared at UNC Health is this poster, and it says to identify, isolate, and inform. So we're instructing all of our care providers at clinics and ambulatory settings and in the inpatient settings to ask persons, have you traveled? Do you have these symptoms, fever, cough? And then just if they say yes to some of these questions, that alerts us so that we're able to give them a mask, we're able to put them into a clinic room and then evaluate them further. So we isolate them with a mask and then placing them into the patient room. And then we want that healthcare provider to inform, so they will call in the hospital the infection preventionist, and in the clinics, that may be calling the health department, and we certainly, if we have somebody that is suspicious, we'll be calling the state number that you see listed there, the 919-733-3419, to say this is the clinical presentation of our patient today. Is this someone that we need to test? Because we have to get permission to do coronavirus. This is a new coronavirus. We don't have kits to test every person.
Do you have
needed.
kits?
We have kits, and we have adequate amount, but not to test every person in our
right, sure.
community.
Yeah.
So you really want to prioritize and make sure
Right.
you're testing people that have symptoms, people that have exposure. So
Yeah.
we
Yeah,
want to
you don't want to test somebody that you think has the common cold.
That's right.
Because that's a
And
waste.
That's
Yep.
right. And so we call that being good testing stewards.
Yes.
You know, good stewards of our equipment, our medication, things like that. So we want to inform. And then another sign that we're putting at our doorways is the one on your right, that it says if you have traveled and you have these symptoms, we want you to wear a surgical mask, and we want you to tell the staff immediately if you find yourself in a setting where you're coming in for provider care. But again, we want to emphasize, always call before coming if you have these symptoms or you think you've been exposed.
If you've traveled
Call
and you
first.
feel bad, you need
That's
to call.
right. Yes.
Yeah.
That's right. We don't want
Absolutely.
everyone wearing a mask.
Yes.
Our
Right.
PPE is limited. Our protection equipment is limited, and some of it comes from other countries. So we want to preserve and use it when needed.
But what about the mask? There's so much controversy
Yeah, we've
about
talked
the
about
mask.
that.
Do we not?
Not if you don't have symptoms of flu or this coronavirus, which they are similar, the distinction being travel or being exposed to a confirmed case of coronavirus 19. But if you don't fit those, if you're not having symptoms, do not wear a mask.
Don't wear a mask out in public.
No.
And I think a lot to be said for that, because when you see a person with a mask on, you immediately go, "Oh God, they're sick."
But
you know,
some of them are preventing
That's
themselves
right.
from
If
getting
they're an
sick.
oncology patient and they're on medication,
Yes.
they're protecting themselves from
Right.
other germs.
so there
in
are
the
certain
area.
people that need to wear them.
That's correct.
Yes.
Yeah.
Yes.
And they know who they are through their healthcare
right.
provider.
Yeah.
Right,
And I think you made a good point about the gloves. You know, sometimes we misuse things like gloves and masks. And, you know, I think in years past when we first came out with bloodborne pathogen, we were instructed to wear PPE. So everybody was wearing gloves.
Right.
But what was happening was we were contaminating more of our surfaces because we wore gloves all the time.
Right.
And
Not
we weren't
washing
washing
your
our
hands.
hands.
Right.
So same thing with the coronavirus. If you feel like you need to wear a mask or you're wearing gloves, you're most likely
Right.
contaminating more surfaces and exposing yourself to more germs.
Right.
And we find that you need to wear those appropriately. If you need to wear it, make sure you cover your nose. We've seen people wear it under their nose.
I know what
and
good is that.
loosely, and it doesn't really work.
Yeah, we talked about that last
Yeah.
week about some older.
laughing.
Yeah, we laughed because
Yeah.
a guy was traveling with his parents, and his parents were wearing the mask down below, and and then his mom was wanting to talk, and she was pulling it up.
Yeah,
So
it doesn't
that
work.
doesn't work.
That's right. Good examples.
Okay.
So this is again the clinical features that we're CDC and our state have provided for us. That's a quick guide for our clinicians. It
That's
again
right.
talks about like a 3-tiered consideration: fever, signs, symptoms of lower respiratory illness, and usually that's that shortness of breath. But then you look on the right side: has this person been in contact with someone who's been confirmed with the COVID-19 in the last 14 days? Then that would be a person we would consider testing. Or if they come in with the signs and symptoms and you look at the second row, they've traveled to an area impacted, then we would consider testing. And then you always have this group here where they have the signs and symptoms, but we look if they have severe acute lower respiratory. Are they in pneumonia? And they're so sick when they present that we think they need to be hospitalized, and they have a pneumonia of unexplained origin, and we don't know that they have any exposure source, but these symptoms are so severe, then we might consider testing them, and we would definitely be in contact with the authorities about this type of case. But again, call your provider before going to your physician or going to a clinic or any place like that, because they may want you to stay home. You're
Right.
safer in your home. We've alerted the officials. They will be calling you. They will be visiting you. And Jamie, you could talk maybe.
Yes,
more,
we have received a lot of calls with people having symptoms of upper respiratory, not really lower respiratory, upper respiratory symptoms, and they're very concerned about the symptoms they're experiencing, and they're wondering, how do I know if I've been in contact and with a COVID-19 case? And I tell them, if you have not traveled and your family has not traveled, you are at very low risk. It's more likely that you have the flu or a sinus
Right.
infection or a severe allergy complication. And you should still call your provider or urgent care before you go in and get direction by phone first.
Okay. All right.
And you guys are really doing all this to prevent the mass spread of,
Yes.
Yes.
of the
That's
few
important.
cases that we have.
This coronavirus situation has not caught anyone in the healthcare community off guard. Our CDC and our state and local partners have always had a plan for something just like this.
Wow.
And we are working in
For a
that
pandemic.
plan. And we're even the president is on board with mitigating travel. So we're working our plan. Everybody is in communication. Even our EMS and law enforcement officers
Yes.
are in
That's good to know.
communication
That's
with
very
us.
reassuring. And that's one of the reasons we wanted to have y'all on this morning, to reassure everybody, because everybody's kind of running scared. Rumors are the worst.
They are.
Social
at
media.
a time like
Yes,
this, and
they are.
social media, yes,
Yes.
not our friend.
Yes.
But anyway, so if somebody gets the coronavirus, what is the treatment? What do you do for them?
There's no treatment. That was on our first slide, we were talking about the immunization for flu, but people are working on that. We have.
But I mean, you can't just give them
Yeah, you need to take-
help the symptoms. I'm not
Right.
talking about. I know there's no.
There's no vaccine yet.
Vaccine.
Yeah.
Do you
But
take
is
Tylenol,
there
cold and
any-
flu?
You do.
Is
You
there any
take-
medicine
you
that you
take
can take to help you
over
feel better?
The over the counter, like you would take those medicines that you can get over the counter for
Yes.
the symptoms. If you have a cough,
Okay.
that type of medication, aspirin,
Right,
Tylenol,
right.
ibuprofen, things like that, over
Okay.
the counter to help the aches and the fever.
Right.
So those
That's
are
kind of what
things.
I was wondering.
And
Yeah.
plenty of fluids and rest
Yes.
is essential. And it wouldn't hurt to call your provider, and if you have other health care issues, to say, what can I take over the counter?
Yeah.
Guide me in that.
Yes.
Right,
They
right,
would
right.
not mind helping you with that.
Well, when we talk
Sure.
about people traveling, it's kind of been traveling outside of the U.S. But how about people traveling within the U.S.? I mean, are you suggesting not to stay in your community and not go to Colorado or Texas?
Right.
Or,
Well, the guidance right now is avoid non-essential travel. So if it's something you can postpone to later, if it's a vacation and you can postpone to later, a lot of businesses that have booked you
Right.
are helping you to do that, to postpone to another time. They are giving refunds, and we're encouraging them and praising them for doing that, because it does impact our economy. So if the travel is not essential, then try to postpone it. Call and see what you can do to postpone
in
that
your
travel.
state.
well, how about if you're driving somewhere? If you're going to go visit family, and you just want to drive. You still saying the same thing?
Because we don't have sustained community transmission right now in most places, but the guidance is still there. Avoid non-essential travel.
And
So
they-
Skype.
Yes.
You don't have to
FaceTime.
see, you don't have
Virtual
to see your
tools.
grandchildren right now.
Right. So tap into those virtual tools.
Yeah,
Yeah.
Skype, like y'all
Yes.
said. Okay, let's go to the next frame.
So again, this just wraps up how to prevent catching the virus. Washing your hands, we've talked about that. 20 seconds. Sing the happy birthday song twice to yourself. Get all those surfaces in between your fingers, your fingernails, and your thumb area. Research has shown those are the areas of our hand we tend to miss, between our fingers, our nails, and our thumb area. Get the back of your hand, your palms, and your wrist. And again, watch how much you touch your face. Sometimes we've
that's
done,
so hard.
Yes, it is. And touching your eyes and bringing your hands up, and wash your hands often, and try to be conscious to wash your hands before you touch your face, and avoid close contact with anybody sick. If somebody's got the cold or flu, wait a couple of weeks and not go around them. Give them time to heal and recover. And again, cover that cough with the bend of your arm, and use that tissue and throw it away immediately and wash your hands. We're talking about preparedness. This is all helping us to be prepared, and I like what
Absolutely.
Jerome Adams, the U.S. Surgeon General, said the other day. He said, "Preparedness over panic," and that really
Absolutely.
resonated with
Oh,
me.
yeah.
So preparedness over panic, and that's what
That's
we're all
pretty good.
doing. And we really have an excellent team of EMS, police, our emergency preparedness, our health department teams, and
Right.
hospital and clinic teams, our doctor's offices. We've even had at the hospital businesses to call us that are not healthcare related to say, this is what we're doing to prepare for coronavirus.
I've
So
had those same calls.
yes, and so really everybody's coming together in the community, and it's a beautiful thing to see.
It really is. And we really do have a plan, and we're working that plan.
Well, this has been so reassuring. One thing I learned this morning, Lisa, I don't know if you already knew it, but I thought this virus was the coronavirus.
Right.
I didn't know that the common cold is a coronavirus. So that's why they're calling it COVID, because it's another strain of this
viruses
it's another
change and
coronavirus.
mutate.
I didn't
Right.
know that.
Yeah, Lysol was already ready.
Yes.
I mean, it
That's
says
right.
it on the back of
That's
Lysol.
right.
You know, that it's to help prevent the spread of this.
And one thing I want to, I spoke to a group of social workers for Nash Rocky Mount Schools yesterday, and I was talking to them about contact time of their cleaner. Don't clean and then dry it immediately.
Let it sit there.
Let it sit for the appropriate contact time, and it will tell you that on the back of the container.
Well, let it dry on its own then.
Well, let's
Right,
talk
let it dry on
about.
its own.
Okay, so talk about the Clorox. The 4 teaspoons to 1 quart. You spray the table down, and you're saying let it dry on its own?
Well, you can spread it around with a paper towel, but it should remain wet for a couple of minutes
Right.
to be effective on that surface.
And we have, like, for example, at the hospital, disinfectants, and it will tell us on our disinfectant labels
That's
that
right.
it needs 3 minutes of wet time.
Okay.
And like our bleach wipe says 4 minutes of wet time. So read your labels
Read
for
the
your home
labels.
disinfectant,
Absolutely.
to Jamie's point, to see how long it needs to stay wet to be effective.
Lysol's the new perfume.
And get a flu vaccine.
Yes.
I can't encourage our public enough. Annual flu vaccine protects most people from the flu. You may get a mild case if it's a bad flu year, but it's not as bad as if you didn't have
Won't be
the
the
vaccine.
full-blown flu.
Right.
Is it too
Get
late
it.
to get it?
No, we still have flu vaccine.
It's her fault I haven't gotten
At
mine.
the
this
health
year.
department,
Yeah.
come and see us.
We usually get it here and something happens, so if I get the flu, I'm calling you. I'm coming to your house.
We always do it on
Call
the
me.
air. They kind of do it on the air. But anyway, okay, let me ask you one more question. Connie, the hospital, do you have a plan in place to quarantine
Yes.
visitors,
Well,
quarantine people in the hospital?
Right now, we have not had any cases in our county, so it is our usual plan that, we allow visitors, but again, we're asking if you have those cold symptoms,
Right.
not to visit.
Just to stay home.
You can send an e-card, you can go to our website and actually ask that a card be sent. It'll be printed out at the hospital, or one of our staff members will deliver it directly to your loved
That's
one.
neat.
And, so there are things we can do until you get well to
That's
visit.
right.
So we just encourage you to stay home, get well, and then, if we have cases in our county, then we might escalate that we may not ask visitors, but we're
Right.
not there yet, but we're prepared.
Right.
And we want everybody to be reassured, and we would communicate our next steps to our community.
And what Connie and Jamie has said this morning, there are no diagnosed cases in Nash County, Edgecombe County, in our community.
Correct.
Is that correct?
That's correct.
And
But
how
Very
many?
good.
Things can change.
They can
quickly,
change,
and we
yes,
just caution
but as of
everybody.
right now,
And I'm going to go back to
we're
the
trying to be preventive.
first
Correct.
slide. How many people died last year from the flu?
Oh, thousands.
I mean, over 100, wasn't it?
In
119?
It was over 100 in our state.
Oh, I see.
And currently, right now, we're 127 from the last statistics we saw on February 29th. We're due to get an update today from the state. In the past 2 weeks, from the 29th, 11 North Carolinians passed away from flu. So you
Wow.
can see that's more impactful to our community
Right.
It absolutely is.
than the coronavirus.
Yeah.
And we can mitigate that with vaccine and antivirals for the flu, but currently we don't have those tools for the novel coronavirus.
Right, right,
So
right.
washing your hands, taking cleaning measures that you usually don't do or think about, use hand sanitizer, cover your coughs and sneezes, stay home if you're sick. Those things are going to be our baseline
Right.
tool to prevent this virus from continuing to spread.
And no hugging
Okay.
right now.
No hugging.
We're sorry.
We're Southerners. We want to hug everybody. Thanks y'all for coming on. What a lot of
Thank you
good
so
information.
much. I
Thank
think
you.
this has
It's
been
our
so
pleasure.
informative. Maybe we'll have you back later on to give us an update. Maybe next time they come, they'll say, "Okay, we're out of the woods."
Yes, we'd love to.
We hope
support
so.
you.
Yeah.
Yes.
Okay.
Thank you.
All right, we'll be right back.